Good afternoon, everyone, and welcome to today's webinar, Patient Involvement in Clinical Nutrition Guidelines and Lay Summaries. My name is Elena Balestro, and I'm Membership and Capacity Building Manager at the European Patients Forum. Before we dive into today's topic and we start talking of what is really the topic of the day, I would like to provide you with a few housekeeping rules to allow you to create this webinar experience even more enjoyable. If you would like to interact with us, you have several ways of doing so. You can use the chat box. It should be a big, quite big black box showing on your screen, and you will be able to chat with us during the webinar. And also, if you have any question along the way, we will take all the questions at the end, and Keith will moderate the Q&A session at the end of the two presentations we will see today. But we invite you to write down your question while they're coming during the presentation. All the questions will only be visible to the presenter and organizer only, so you won't share it with the whole audience, so they can also be a bit private. And please do let us know if you would like to be not to be nominated as a person with your name, your full name during the Q&A session. You want your question to be anonymous. The PowerPoint presentation will be shared with you afterwards, so there is no need to take notes, as well as this webinar is being recorded and will be uploaded on EPF YouTube channel later on. So I advise you to subscribe to EPF YouTube channel if you haven't done so yet, and to also click on the little bell that allows you to receive all the notification of any new webinar or any new video that EPF will be uploading. So without any further delay, I wish you a fantastic webinar experience, and I hand it over to my colleague Keith to introduce the webinar and the agenda.
Well, thank you very much, Elena, for the housekeeping rules for this webinar. I think for me it's the first time, so it's always good to have this before. My name for the people, I'm Kees Smit. I'm policy advisor for the European Genetic Alliance Network, and for EPF I'm working on the nutrition issue, and I'm also sharing the nutrition cluster from EPF together with Katie Gallagher. But because Katie is on pregnancy leave, she is replaced for half a year by Tanya L. Nimmer, and she will now introduce the work EPF did so far on nutrition in, let's say, about a short 5 minutes.
Thank you, Kees. I also have the pleasure to introduce our two other speakers, who are Professor Stefan Bischoff from University of Hohenheim, as well as European Society for Clinical Nutrition and Metabolism, as well as then Isabel Mannek, who is Head of Health and Research Programs at the European Cancer Patient Coalition. And before we go to their presentation, I will give you a quick overview of EPF's work in this area of patient involvement. We will start from 2012-2013, when EPF published a book, and this book was on nutrition and diet in managing long-term conditions. The book is called Patient Perspective on Nutrition, and it was published together with European Nutrition for Health Alliance and the Patients Network for Medical Research and Health. And what this book highlights is that nutrition is a vital part of health and can work both preventatively, but also as an enabler for disease management. And the background for this book is that nutrition is not yet an integral part of disease management, and many patients with chronic diseases face practical problems because of the incompatibility of nutritional needs with their disease or condition. And concerning this, EPF, in cooperation with European Nutrition for Health Alliance and Patients Network for Medical Research and Health, developed a memorandum of understanding in which these organizations commit to collaborative activities to raise awareness on the nexus between nutrition and effective integrated care continuum for patients. And this MOU was quite significant because it formed the basis of numerous initiatives at EU and national level to drive forward nutrition through the lens of patients. And concerning EPF's policies in health, EPF, in line with its responsibilities as an agent for public health, for our specific constituency, has decided to elevate its strategy in the sphere of nutrition with a particular accent on medical nutrition. Which brings us to a recent milestone. This was the European Patients Conference on Nutrition in June 2017. The recommendations from this conference made the bridge between more generic awareness activities to more strategic, focused work to drive nutrition as intrinsic to patient outcomes. Another outcome of this patient nutrition conference was that the EU Patient Task Force on Nutrition, which EPF set up in 2018. It is made up of volunteers from the EPF membership as well as the other EU patient organizations. And what this task force did, it developed this document on clinical nutrition guidelines and summaries for patients. And it is really about also the need for improved patient involvement in the development processes, the importance of health literacy and informed decision-making concerning food and nutrition. It was also to guide this exercise of enhancing the development of comprehensive summaries of recognized nutrition guidelines for patients following the request of the patient community. This was done in cooperation with scientific societies and healthcare professionals, including the European Society for Clinical Nutrition and the European Federation of Associated Dietitians. This document also underwent consultation with the EPF membership. And then what exactly is this paper about? It underlines the importance of information to patients on food and diet choices. It provides an overview of existing nutrition guideline development processes. It highlights evidence-based scientific nutrition guidance available for specific disease areas, while giving examples of existing examples of patient-friendly summaries of this information and nutrition guidance developed by patient organizations for patients. Also, this paper explains why patient summaries of clinical nutrition guidelines are needed, and it aims to inspire scientific societies and guideline developers. And lastly, it provides recommendations for improving existing guideline development processes, improving patient involvement, and the development of patient summaries. And it is intended for scientific societies, patient and care organizations, as well as healthcare professionals and their organizations. And what is next? Well, it brings us to this webinar, which builds on this paper I just discussed, and also our EPF collaboration with ESPN. One of this will be the lay version format of existing clinical nutrition guidelines for patients and caregivers. And this is considered by both patients and ESPN to be a high priority for future work. And EPF and ESPN currently are in the process of formalizing a collaboration in the context of this project with respect to the development of patient versions of guidelines and to ensure strong patient involvement in the review of new guidelines. EPF will work closely with its membership and the wider patient community to facilitate patient involvement in ESPN's guideline-related activities. EPF also hopes to work closely with European Federation of Dietitians, who can use their expertise and people-centered skills to ensure guidance is relevant and easily applied. which brings me to the end of my presentation. I would now like to give the floor to Professor Stefan Bischoff.
Hello, can you hear me?
Yes, we can. I'm just gonna change the presentation so you will be able to see your final one.
That would be great. Sorry for the disturbance.
No, just a second, one more. I hope it's this one. Should be this one.
This looks good.
All right, and I'll also give you the remote control.
Okay.
You have the power now.
Thank you very much. Thank you, everybody, and hello. Sorry for the disturbance with the slides, and thank you in particular that you could update it. My name is Stefan Bischoff. I'm Guideline Officer for the European Society of Clinical Nutrition, and this society takes care for clinical nutrition guidelines since many years. Besides me sits Anna Schweindin. She takes care for the editorial, for the Guideline Office that supports the Guideline Officers with their work. She has a quite important position because she is coordinating all our guideline activities between Central Aspen and the PEN societies in different countries across Europe and beyond. We produce guidelines since many years, as I said, but we realized that not all of these guidelines are implemented in a way we would like to have it. And that's the reason why we started thinking of a guideline dissemination and implementation program since at least 1 year. And luckily enough, we found a very important partner, which is the UEG, the United European Gastroenterology Society, also an umbrella society for European gastro societies, and again, a society very active in clinical guidelines, and they promote guideline dissemination and implementation. So we decided to do a joint effort to better disseminate and implement our guidelines. And we have now also a grant that supports these activities. And when raising the ideas how to do that, there was immediately also the idea to think of patients' versions of these guidelines. That was actually the reason why we approached the European Patient Forum, and we are very happy to have you now as partners in that project. As I heard, you have also direct contact to UEG, which might further support these activities. Now I will move on. I think there's no question about the importance of patient involvement for several reasons. First, it's a purpose of not all, but at least many patients to better understand therapeutic proposals by the doctors, to have a broader availability of information, and also to understand better these medical terms that are used in recommendations and proposals. So the solution of these goals is to produce lay versions with your help. And finally, this is, I think, a very important way to add value to the guidelines. This is an overview of the guidelines we produced during the recent years. It's not all guidelines that are available, but the newer one, let's say, since the last 5 years. And you see the list is now growing year by year, and we have now 20 guidelines in the pipeline. Of them, 15 have been published. These are the bold guidelines, and another 5 are in the process of preparation. The next slide shows you very briefly about our methodology. About 5 years ago, we updated substantially our methodology, how to produce guidelines. Actually, we followed rules that have been established by NICE and SIGN, and also the German methodology of producing guidelines. So I think we have now a methodology that enables us to produce high quality guidelines. I won't go into the details because the methodology has been published in 2015 in Clinical Nutrition Journal. But basically what is important is that we have, apart from literature screening, which is the basis of every good guideline, a two-step consensus procedure. The one step is usually done by an online procedure, and the other one by a physical meeting, the so-called final consensus conference. That means that there are 2 levels, a formalized procedure and a very transparent procedure also, how to generate consensus. And I think personally, especially from the point of view of patients, this consensus procedure is as important as the evidence procedure coming from literature. So, where are the steps where patients could be involved? I think more or less at every step of guideline procedure. It starts already at the very beginning when there is a discussion about the topics and key questions that should be addressed. We call them PICO questions. And it's very important to participate in that early step, because at that level, it will be decided what is the agenda of the guidelines, what are the topics of the guidelines. And the important thing is, are the patient's needs adequately addressed? The next step is the review of the recommendations. Once the recommendations have been produced by this methodology I just briefly mentioned, the question is, do the recommendations address the patient's needs? And do the commentaries also address the patient's needs? The recommendations are very much, and to a large extent, depending on what the literature is proposing, but what is missing could be addressed in the commentaries. And therefore, it's not only about the recommendations, but also about the commentaries that you patients should look at. Of course, there is a strong wish that patients' representatives participate also in the online discussions and finally also in the votings. It means it's not only the option to say your opinion, but also to participate in that voting rounds. And as I said, we have 2 voting rounds, one online voting round and one physical meeting voting round. And that means attendance of the final consensus conference, or if this is not possible for this or that reason, sending at least comments that should be discussed at the final consensus conference. And the final consensus conference is again a very important step in the production of the guideline, because after the final consensus conference, recommendations cannot be changed anymore. And they will also not be reviewed in a normal review process by the journals, because it's the result of the final consensus conference, and there is no way that singular persons or viewers can change these recommendations. So what we would like to ask you at this stage is that we see possible involvement in 2 ways from the patient side. The one way would be that at least one patient representative participates in the guideline production process. We did that in the past, but it was not systematically organized as we aim it for the future. That means if we could have the chance to involve some patient representatives, we did that. And of course, it makes sense in particular guidelines. It makes perhaps less sense in other guidelines. But the 3 newest, namely nephrology, hospital food, and micronutrients, are still lacking patient representatives. So this would be an open field. For the others, either they are completed or we have already patient representatives. But for number 18, 19, and 20, nephrology, hospital food, and micronutrients, we really would appreciate if we could find some volunteers that participate in these guideline rounds. That would be our one question to you. And the other one would be that you, does it move? Yeah, that you participate in this spreading knowledge program. This is what I named before guideline dissemination and implementation. To explain you a little bit what this means exactly, there are four goals we would like to achieve. The one is, and that's a basis for all the others, that we have to produce what we call short versions of the existing scientific guidelines. We call them also practical guidelines because they are shorter, they are more easy to read, not only for the patients, but also for the physicians and for the clinicians in daily practice. These practical guidelines, these shortened versions of the scientific guidelines would be the basis for translation for producing national language versions. And we offered that option to our pen partners in many countries within Europe and even outside Europe. And we have already a long list of people interested in translating these practical guidelines into national languages. Third step is that we will produce from these practical guidelines not only the classical printed versions, but also app versions, electronic versions that will be presented on smartphones, on tablets, on computers, on websites, etc., with a kind of animation and graphical presentation of the content. And last but not least, we would also would like to produce from these practical guidelines these lay versions, patient versions. And here we propose that we nominate, with your help, 1 to 3 people, patients interested in doing that job. I think a small group would be nice. Theoretically, it would be also a single person, but a small group would be nicer, not only because it's less workload for the single person, but also they have the opportunity to discuss this and that issue among each other. And then the result will be reviewed by one of the people from the original guideline group, usually the leader of the guideline group, that by transferring it from the scientific version to the lay version, no mistake is included or misunderstanding or something like that. If the group leader has the feeling that might have happened, then the group leader should contact this patient group and clarify the issue. And these lay versions will be primarily produced also in English language, as all our guidelines are in English language. But later on, once they are produced in English, they could be also translated into national language versions. That would be also a nice option. So we would provide these practical guidelines. As I said, there could be this transformation by 1 or 2 or 3 patient representatives. There are a few rules. For example, there is no way to change the recommendations because, as I said, this is a result of this complicated consensus process. But there is the option of a kind of translation or explanation of the recommendations and also of the commentaries. As I said, to my opinion, these commentaries are quite essential because explanation, understanding of recommendation is very much depending on what the commentaries explain. And there is this proofreading I just mentioned, primarily it would be English language, but as I said, in future also transferable into national languages. So among these 20 guidelines, we selected 10. The reason for selecting these is that we have that cooperation with UEG, and UEG is particularly interested in a number of guidelines, especially guidelines that are somehow related to gastro, liver, intestinal field. And these guidelines we selected together with UEG. Among the 20 are the 10 in red or orange color you can see. And for these ones, we need now partners from your side. And you mentioned nicely in one of your last emails that the ECPC organization could be a partner for the oncology guideline. And step by step, we would need now nomination of partners for all these guidelines as much as possible with your help. And hopefully we will achieve that in the near future, because actually we would like to start soon. And we already started a little bit. We need a kind of template for one of these guidelines. This template is about the inflammatory bowel disease guideline, the IBD guideline. But still, it's not yet published, so there's still room to jump in. And of course, there's no version so far. That is actually what we would like to present to you today, and we are happy to answer questions. Thank you very much.
So thank you very much for this interesting presentation. We will now move to the slides of ECPC. Just a second, because there have been some latest updates. So we want to share with you the latest version of presentation. And Isabel, I will just give you the control.
Okay, thank you so much. Hello, everybody. My name is Isabel Mane. I'm Head of Health and Research Programs at the European Cancer Patient Coalition. In that, I'm actually a registered pharmacist and a licensed public health professional who's also experienced in public health policy and health research programs in general. I've been working with ECPC for the past now almost 3 years, and I've been working to help improve the quality of life of patients for the past 10 years now, over 10 years now. I've been working with EPF for very recently. We've been working on several things, including nutrition. I'm very happy for this established collaboration specifically. So I'm just going to cover a little bit about ECPC in general, just in case some of the patients out there are not well aware of our activities. Okay, oops. So ECPC is the largest European cancer patient umbrella organization. We were established in 2003. We have over 450 members, and this includes EU countries and non-EU countries. So in a total of 46 countries. We advocate for patients to be acknowledged as equal partners and co-creators of their own health. This includes in several of the European Commission projects on health and research, as well as overall policy. We work for a Europe of equality, where all Europeans with cancers have timely and affordable access to the best treatment and care available throughout their lives. So we work basically on, based on our multi-annual strategy. This one is coming up to an end. So between 2017 to 2019, we're currently actually drafting a new annual strategy. And these cover the following areas. So governance, policy, capacity building, and health and research. Within the governance, we've been trying to build a sustainable governance model for our organization and our members. In policy, we're trying to influence the EU legal framework and the European and national political agenda. And in capacity building, we're trying to empower the cancer patient organizations and our members in general, and enhancing their abilities to shape the national policy. So working on ground level, basically. And in health and research, we're trying to increase the role of patients in cancer research to be actually working as co-creators of their own health. So as mentioned, we're working for Europe of Equality. We are trying to make sure that patients have timely and affordable access to the best treatment and care available throughout their life. We believe that cancer patients are the most important partners in the fight against cancer and against all cancer-related issues affecting our society. We're advocating policymakers, researchers, doctors, and industry. And we believe that they should recognize cancer patients as co-creators of their own health, as mentioned. We're drawing our fundamental knowledge and understanding of the patient situations by working through our members. And this is really important. On our board, we have several patients or patient advocates. And within the staff, also within the secretariat, we have patient advocates, but as well as carers too. So our on-field engagement enhances our capacity not to only truly represent the patients at the EU level, but also we try to provide irreplaceable first-hand understanding of the issues revolving around cancer patients. As I mentioned, within my work, we work on EU-funded health and research projects, which allows us to be at the forefront of scientific developments in cancer. This provides the patient's perspective while still draining fundamental knowledge on the science behind cancer. We've been participating in the EU's third health program, as well as several other EU's research and innovation framework programs, the 7th framework format, the IMI 1, the IMI 2, so several of these that we're quite involved in. As you can see, this is the development of the work within the EU health and research programs over the years, and this is only increasing. We're trying to emphasize the importance of involving patients as co-researchers, but also we're strongly advocating for the best partnership model, which I think here is really essential for us all, especially when we're working on guidelines. It's the same thing. We need to advocate for the best partnership model between the scientific societies, but also with patients' organizations. So researchers, patients, and allowing patients to contribute their unique experience, working towards a more patient-centric study while still participating in crucial decisions. So ECPC also has a background. We're an active member in the Worldwide Innovative Networking Consortium in personalized cancer medicines. We contribute to the mission of rapidly translating personalized cancer medicine discoveries into standards of patient care worldwide. At the same time, ECPC also, we're working very closely with the European Society of Medical Oncology, and we have signed also a memorandum of understanding with the aim of enhancing the existing cooperation and increasing efforts to achieve the common goals and objectives in the field of cancer to satisfy new needs and new rights of cancer patients across Europe. The memorandum basically establishes a legal framework for current and future collaborations. These kind of collaborations include us contributing to patient guidelines. What are we doing on our part? We have signed this memorandum back in May 2016, updated 2018. It's not only a formal agreement, but also a practical collaboration on concrete projects. So this includes the update of the ESMO guidelines, as mentioned, update of patient guidelines, but also we have drafted an ECPC ESMO survivorship patient guideline. The first topic on which ECPC and ESMO started collaborating was actually survivorship care. I can give you a little bit of background in that regards too. The survivorship is a unique and ongoing experience, which is different from each person and was close to them. A key to survivorship is to regain as far as possible the important aspects of your life before cancer and to find new pathways to have a satisfactory life going forward. Survivorship focuses on health and the physical, psychological, social, economical issues affecting people after the end of preliminary treatment for cancer. So survivorship care includes issues related to follow-up care, management of late side effects of treatment, and psychological and emotional health, which comes very closely to nutrition too. Survivorship care also includes future anti-cancer treatment where applicable, and family members, friends, and caregivers should be considered as part of the survivorship experience. So the patient guideline that was produced with the help of ESMO actually covers the following topic: support in coping with new reality, who can help me, life after initial treatment, how can I get my normal life back, preventative care, what lifestyle changes can I make to achieve optimal physical and emotional health, and follow-up care, just as a quick summary of that. ECPC now has started collaborating also on the clinical practice guidelines, and on this EPF has asked me to join and also try to explain how we're working with our members to help with that. So we have not only been working with ESMO on a large range of key policy issues related to cancer, rare cancers, data protection, and immuno-oncology, but we also have decided to partner up with them to include a more patient-friendly and solid survivorship care provisions, but also to produce these patient guidelines. ECPC and ESMO will ensure that these guidelines for patients will include updated provision on survivorship care in line with the clinical guidelines. And in the coming years, each updated ESMO guideline will contain a reviewed patient-oriented survivorship chapter. And how we actually do this before we move into the nutrition, we basically review the clinical guidelines provided to us by ESMO, and then we try to map out the best patient organizations available around us, either partners or member organizations, and we contact them and we review it together and then provide the feedback and work with ESMO in making sure that the feedback is taken into account. In regards to nutrition, we believe that nutrition is a crucial component of cancer treatment and rehabilitation, as obviously it helps patients better cope with the illness. But as we all know that cancer and its cure is basically the main focus, and nutrition is often neglected, leaving patients and their families with doubts, questions, need for practical guidance, and how to eat better on a daily basis, especially during therapy. So in 2015, ECPC actually sent out an extensive survey on nutrition and its importance on the treatment and life of cancer patients. So there was a preliminary data obtained from the survey suggested, and there were still some discrepancies between patients' expectations and the answers they may get from physicians about their metabolic and nutritional issues in cancer. So based on that, we tried to build on a more scientific pilot survey in 2016, where we continued our effort with a second round of questions in order to have enough data and maximize the impact of the answers received. The new version of the survey was adapted in order to directly address the individual cancer patients and the cancer survivors. It was aimed to describe and understand the perception of the importance of metabolic and nutritional problems among patients and cancer survivors. The study was conducted by surveying the cancer patients and survivors this time. And there was a structured questionnaire that was designed to analyze the importance of nutrition for people with cancer. A total of 907 patients and survivors were interviewed at that time, were surveyed. This was distributed in 10 European countries, including Finland, Italy, Spain, Czech Republic, Greece, Denmark, Slovenia, Romania, Poland, Bulgaria. And obviously it was also translated, it wasn't just in English. Results showed a substantial gap in terms of the need for information and the practical management of cancer-related nutritional problems. We could have seen, so part of these results, that more than half of the physicians did not pay attention to weight loss. Almost 2/3 of the patients knew that persistent loss of appetite could be caused by the tumor. More than 70% of the participants experienced feeding problems during the disease and/or therapy, and all responders declared to be aware about the feeding importance. Almost 30% of the sample had no information on nutritional support, including artificial nutrition. It shows that the majority of physicians, also 53.9%, did not check the nutritional status of their patients, including their body weight, or did not refer to patients with feeding problems to a nutrition specialist. So this is a major issue here by itself. So on November 2017, our MEP champion, Daciana Sârbu, she collaborated with us, and we hosted an event at the European Parliament on the important topic of the role of nutrition in cancer care. The results of this, the preliminary results of this study, which we conducted it with a survey and in collaboration with Sapienza University of Rome and Healthcare International, was illustrated there, and it explained the importance of nutrition for people with cancer. It was presented by also in ESMO in the Congress in 2017 as a poster session, as an abstract at the same time. Building on that, we did a consultation document where we thought it would be really essential to try to close this gap of information and provide a patient booklet for cancer patients to live well during cancer treatment. Based on the consultation that was released, we have built this Living Well booklet. The booklet was endorsed by the European Society of Surgical Oncology. It was also presented at EONS last year at the European Society of Medical Oncology 2018 Congress session, and it will be again presented this year. The Living Well booklet addresses the cancer patients' concerns based on the ESPEN guidelines on nutrition in cancer patients, and also took into consideration the ESMO Handbook of Nutrition and Cancer. So we bridged the gap between both of them. The content includes the European survey, which we discussed, a chapter on what living well could mean, screening, a chapter on body mass index, nutrition guides, several recommendations, but most importantly, what we think are really essentials are the 8 questions to ask your oncologist and the key messages. We further proposed a cancer patients charter for rights for appropriate and prompt nutritional support, and a glossary. And the Charter of Rights, we're trying to push that locally through our members. I'd like to also bring to your attention the Living Well Healthy booklet. Is not intended to offer medical advice or replace advice given by a healthcare team. It is complementary for the patients. We believe that living healthy during cancer treatment is a combination of good nutrition, which consists of an adequate and well-balanced diet and a regular physical activity. However, the nutrient needs of each individual may vary, so you need to consult with your cancer care team to make sure that they help identify your nutritional goals and needs. So thank you very much.
So thank you very much, Isabel, for your explanation of the work of ECPC on nutrition. And I think with the 2 presentations together, we have seen a good overview of how the scientific guidelines are developed and where patients' input can be used. And from ECPC, we have seen a perfect example where already a patient group is working together with, let's say, 2 scientific societies, ESPEN and ESMO, to develop a lay version of a guideline on nutrition. So I think now it is up to the listeners of our webinar for, let's say, their questions. And I suppose that we have about 10-15 minutes more for this webinar to address your questions. And the first question is from Jean-Charles Kaiser, and that relates to intensive care unit guidelines, where he is mentioning that he is not aware of any organized group of intensive care patients. In addition, an intensive care unit patient can widely differ between countries and hospitals. Well, that was one of the questions I also formulated in advance for this webinar, that for some of the disease groups that were mentioned, that there is no specific patient group. But I think in case of intensive care patients, there is a patient group for that in the Netherlands. So for that, we can contact them. And that's an organization that is developed about 3-4 years ago by family and relatives of people who were on an intensive care unit, and also patients who, let's say, came through their difficult period at an intensive care unit. And altogether, they started a patient group for ICU patients. And they are very active, and I have also had contact with them, and they are very interested to start a topic of nutrition for ICU patients. And earlier in our nutrition conference in 2017, we already discussed this topic also with Dr. Preiser from Brussels. And he also mentioned that in the medical data from patient groups, from patients in the hospital, there is often no information on their nutritional status also, and also not their particular diet wishes and so on. So that's certainly a topic of attention also for the ESPEN guideline in development on that, or that was developed on that for the future, data on nutrition should be included in medical records. So I think we have addressed this question. And of course, it can also differ between countries and hospitals if there is a patient group, but we will do our utmost best to find people who can participate in making a lay version of that. And then there is another question about caloric restriction, which is very popular among cancer patients. And that is most of the time not related in detail in the professional guidelines. Maybe, Stefan, could you comment on that?
Yes, indeed, this is also a little part of our oncology guideline. We are quite cautious with restriction of diet in cancer patients.
Can you speak to the microphone?
Can you hear me?
Yeah.
Can you hear me, Kees?
I can hear you now very clearly.
Okay. I said, yes, this is also a topic, not a huge topic, but a topic in our guideline. And our opinion is one has to be, for the moment, quite cautious in restricting energy intake in cancer patients, because what is definitively a risk is malnutrition and undernutrition in the cancer patients, namely in the cancer survivors, whereas the benefit of caloric restriction is of limited evidence. That means it's a quite interesting research topic. It's obviously only a quite short time frame where it could help, namely in the time frame where chemotherapy will be administered. So I think we need to look carefully on clinical trials to get a clear idea about the evidence, and not to lose our cautiousness or awareness for malnutrition in cancer patients. And it depends also on the type of cancer. For example, if you have a cancer like pancreas cancer, these patients are of enormously high risk of undernutrition. In these patients, I would be even more cautious in considering a kind of caloric restriction, unless we have not very clear data. In other cancer entities, it might be less complicated.
Okay, thank you very much, Stefan. For the listeners to our webinar, it's still open to address your questions for maybe very basic questions, but also for clarification questions on the presentations. Maybe Isabel, I also had a question to you. What would you normally recommend a patient when he or she asks, where do I go for information on nutrition? Isabel, are you still there?
Sorry, I was on mute.
Okay, sorry, but did you hear my question?
Yes. So obviously, as the Living Well patient booklet explains, our first reference for the patient is their medical oncology team. We always suggest to always go back to their oncologist or to their medical team. However, if they have not received the support, clearly we try to obviously to disseminate our brochure, so our patient leaflets, and at the same time, that's why we've been trying to translate them to make sure they open their eyes to what other possibilities also exist. So there's also patient support groups, and also working with dietitians is also essential. But what ECPC has been doing is we've been trying to make sure that everybody works together. So oncologist works with the nurses. So the work with the European Society of Surgical Oncology, of the European Society of Medical Oncology. Also, we're working with EONS, the European Oncology and Nursing Society, but also with the dietitians. So a combination of everybody coming to work together, I think, is the best option for the patient.
Yeah, thank you. And then we got a question from Howard Dunn. He is from the European patient group with genetic hemochromatosis, which is a question of iron overload. And their nutritional guidance is a constant request from patients. And Howard knows from the experience of the UK organization that they have a nutritional guideline booklet, and other European patient groups may have also, but the question is, how should we proceed with Aspen on, let's say, iron overload to have a European guideline? Stefan, can you have an answer on that? Because I think we did not see gross hemochromatosis on your list as far.
Yeah. We address hematochromatosis a little bit in the liver guideline, because it's also a liver disease, and we have a liver guideline in which this disease, if I remember correctly, is covered. We do not have a particular guideline now on this type of disease, just one focusing only on that disease. But as I said, I think it's covered to some extent in the liver guideline. And so, if I may add to the comment before from Elena, I think it was, I think it's well taken that all these guidelines and lay versions cannot replace the recommendations of the professionals team involved in patient care. On the other hand, I think we need more than the existing guidelines on therapy, in particular with regard to nutrition. Without offending our colleagues from oncology, a large part of them might be excellent oncologists, but are not always familiar with the details of nutrition. And that's the reason, as we just heard, why nutrition is somehow neglected in many guidelines, briefly mentioned. And that's actually our motivation to produce our guidelines, focusing on clinical nutrition.
Yeah, so in summary, you are mentioning that the specific guideline developers for a particular disease maybe risk that there is not enough attention for nutrition in these scientific guidelines, and that the specific focus of ESPEN is on nutrition in the guidelines.
Exactly.
And for that you strive, let's say, for cooperation with other scientific societies, like, for instance, with UEG on gastroenterology.
Yeah, and also with appropriate patient organizations, because it's clear that we have areas in medicine where more or less the doctors must make decisions. But for nutrition, I think this is a particular example where not everything is as fixed as in other areas of medicine, and where patients' expectations, wishes, questions are more urgently needed to be addressed than in other areas. Therefore, I really think that nutrition is an excellent field for patient participation, even better than some other fields in medicine.
Okay, thank you for that clarification. And I think that especially in the media nowadays, there's a lot of information on nutrition and food, and there is almost every week a new hype. So it's very difficult for, let's say, the general public, but also for specific patients, to distinguish what is the right kind of information which is addressed through the media about nutrition and food, and what is has to be taken seriously from, let's say, a physician's perspective. Can you clarify, maybe, Stefan, also what is the difference between the national PEN societies and ESPEN? Because when the national societies are also developing guidelines, is that, let's say, a guideline which is translated from a European perspective, or is it also adapted to the national circumstances?
Yeah, that's an important question, and actually only a few national PEN societies and nutrition societies still develop their own guidelines. For example, the German Nutrition Society did that until now, but also we in Germany decided to follow now the ESPEN guidelines. And the majority of the, let's say, smaller countries cannot afford to produce their own guidelines. It's just too expensive, too time consuming, and you need to find the volunteers, etc., etc. So I think the future goes for the ESPEN guidelines, and the national societies will adapt somehow these ESPEN guidelines. And I think this makes also sense because nutrition in Germany and in France and in Italy and in the Netherlands will not be principally different. And there is the option, if there is a kind of particular national requirement, to make an amendment to address that. So I think it really makes sense that we have now common guidelines across Europe. And therefore, I think also for the lay versions, it really makes sense no more to follow some activities at the national level, but follow the way.
Stefan, we have one more question, and that's also the last question for this webinar.
Okay.
Maybe you can again speak quite near to the microphone, because sometimes we cannot.
Okay.
Very good.
I don't know where the microphone is in the computer, but I try my best.
Okay. And the question is more or less how to communicate on the level of evidence or the level of consensus in guidelines.
Yeah.
I think that was addressed in the guidelines, what was the level of evidence. But then they also say that perhaps we have to realize that current recommendations will change in the future. So maybe it are two questions about the level of evidence, and be aware that recommendations can change in the future.
Yeah. The level of evidence is within the ESPEN guidelines always indicated in letters. And we have the 3-letter indication that means A means high evidence, B means moderate evidence, and 0 means low evidence, which is not no evidence. It's much more than no evidence. 0, sometimes people feel it's kind of no evidence. This is totally wrong. It's a low level of evidence, but it must be evidence. And we have a fourth category. This is what we call clinical practice point. These are recommendations that have actually no clear evidence, either because there is no study made or for ethical reasons, a study cannot easily be performed. But we still feel in the group that's an important topic where we need a recommendation. And very much, or very often, patient requests end up in these clinical practice points. Therefore, I think, in particular for nutrition, this fourth category is quite important. So with all recommendations from ESPEN, you see either a B, or a 0, or a clinical practice point indication. That's the way how we indicate evidence. The check for evidence will be made in the guideline group, where we aim that each of the guideline groups has at least one patient representative. The consensus is indicated in ESPEN guidelines with a percentage. And that's actually the percentage of people who participated in the consensus procedure and who agreed to the recommendation. And we need a minimum of 50% consensus. If it is below 50, the whole recommendation will be deleted. But we aim to have more than 75. And if we have high evidence, then we need more than 90% agreement. And that's the way we go, and this is a methodology that has been accepted.
Okay, Stefan, thank you for that. So this means that we will come to an end of this webinar, and when I summarize the request from ESPEN in, let's say, 2 points, that is that we need the cooperation of European patient groups on, let's say, future scientific guidelines where the patient input is requested, and that we want to have, let's say, patient groups who want to work together with us on lay versions of already developed guidelines. We will make a short summary of the requests, and that will be published shortly in the EPF newsletter. And you can watch again and listen again to this webinar on the YouTube site from EPF. And there we will also make a short summary maybe for what are our requests. So I will now give the floor to Alina for the closing of this webinar.
I thank very much. Thank you very much, Kees, and thank you very much all the speakers who participated in this webinar. All the questions that couldn't be answered during this 15 minutes Q&A will be addressed by email later on by our speakers. And as Kees said, this webinar recording as well as the key point will be shared in our weekly insider, so the newsletter that goes out to all our members every Tuesday. It will be, if we manage, already included tomorrow, or if you won't see it tomorrow in the weekly, you will see it next week. As well, this webinar and the videos will be available on our YouTube channel. And I advise you, if you haven't done so already, to subscribe to EPF YouTube channel and to activate the little bell that allows you to receive every notification every time there is a new webinar or a new video uploaded. I thank you very much for listening, and thank you very much for participating to all the speakers. I wish you all a lovely afternoon, and see you at the next webinar.
Thank you very much.
Thank you.